How to make healthy decisions with the COVID perimeter framework. You are a world-class business architect. The governor has just invited you to help her deal with the coronavirus problem in her geographical region. She can redirect money and resources if she knows where to. How can you help? In this video, we'll use business architecture principles to help the governor. The intent is not to be comprehensive, but to give you one perspective, because there is no one right way to approach a challenge like this. In the future, we may be hit with more global challenges, and we business architects are in a great position to help. Challenges could be things like the water crisis, cyber attacks, extreme weather, and biodiversity loss. The coronavirus issue is a global problem, and different stakeholders are looking at it from different perspectives. The broad category of stakeholders are citizens, government, and businesses. For example, citizens include working moms and dads who have to protect their family. Government includes politicians who have to make right decisions for the public good. And businesses include managers who have to guide their teams on priorities, or doctors who have to serve patients in a safe and effective manner. These stakeholders also interact with one another. For example, a manager at a face mask manufacturing plant might have 2 kids who are at school, and he has to set up a virtual schooling system, while also connecting with the distribution manager to prioritize delivery to the hospital administrator. Because the region's governor sent out a directive to prioritize hospital deliveries, and patients who feel sick could go to the hospital and get treated by doctors. The interactions are complex and many. So let's attempt to model this complex ecosystem. The most important stakeholder in this ecosystem is you. As we think of you, your family, your job, and your life in the coronavirus context, it is important for you to establish a social perimeter and take appropriate steps to reduce contact with the virus. This means that you will have to maintain social distance, reduce travel that takes you well out of your safe zone, work remotely, and clean up surfaces that you come into contact with often. Your family is part of your inner circle, and you have to include them in your space and establish a perimeter for protection. Outside this space is space for your friends and family, and outside that is the rest of the world. Sometimes you have to go to that space, like if you're a doctor. But the more you go out, the more risky it is. Your actions are based on collective responses of individuals, as well as playing your part, and the actions you take have a ripple effect on other stakeholders. For example, if you run an airline company, one of the decisions you might make is to reduce the number of flights. That decision will reduce your profitability, but you make that decision based on a number of factors, some more important than the others. These could include keeping employees safe, reducing the risk of litigation, considering brand perception, considering that there will be a huge reduction in the number of people who will travel, or having to follow a government directive. On the other hand, if you're a hospital administrator, you'll make entirely different kinds of decisions. Your hospital will stay open. You want more doctors and staff to come in to treat patients. You have to ensure their safety, ensure that there is enough medical supplies, equipment, medicines, and beds available for the high influx of patients who are going to seek treatment. If you're part of the government, then you might enforce rules for different entities to follow, like shutting down large gatherings, close borders, close non-essential businesses, direct companies that supply hospitals to prioritize such deliveries, direct tech companies to use data to stop the spread, and educate people on the norms of social distancing. You might decide to give a stimulus package for businesses that are losing business and compensate citizens who are unable to work remotely. We'll not get into all the complexities of such an ecosystem, but as you can see, one can systematically analyze different parts of this ecosystem to make different kinds of decisions. In this video, we'll introduce a simple framework for people to make decisions on their own activities. We call this the COVID perimeter framework, which is similar to the ODA loop that fighter pilots use to enhance their decision-making instincts. The framework will help you make a decision on every activity that you do. We know the best way to curb the spread of the virus and reduce the chances of infection is to avoid direct or indirect physical contact with it. Here's how you would use the framework. First step is to wear the right stakeholder hat. Are you acting in the capacity of an independent citizen, or are you acting in the capacity of a doctor? These will lead to two different circumstances as we showed earlier. Then you ask the question, is there a chance for contact with the virus? Yes or no? For some activities like in-store shopping, the answer is yes. But for other activities like sleeping, the answer is no. This is the I part of the framework that stands for the word information. If no, then you don't have to worry. Go ahead and do the activity. If yes, then use this tool to help guide your activity. Your activity will fall into one of these combinatory buckets: essential or non-essential, and digital or physical. If the activity is essential but requires physical presence, then you can explore a few options. You might want to be extra careful and take all the necessary precautions. A doctor treating an infected patient falls under this. If we can convert this activity to the digital activity, that'd be great as well. For example, a doctor could diagnose and prescribe medications to some patients remotely, thereby reducing the probability of contamination. This is the C part of the framework that stands for the word careful. If the activity is non-essential and can be done digitally, like checking the balance on your bank account, then it does not matter if you do it or not. It's up to you. This is the O part of the framework that stands for the word optional. If the activity is non-essential and cannot be done digitally, then avoid it. Don't have a party and invite friends over. This is the V part of the framework that stands for the word avoid. If the activity is essential but can be done digitally, like working from home, then you're good. This is the D part of the framework that stands for the word do. How do you get an idea of all these activities? Think about the decisions within your personal life on activities like eating, sleeping, working, shopping, family care, socializing with friends, and hobbies. They're simple enough. But what about large businesses like a hospital or airline or even a government department? Coming up with an inventory of all these activities they perform and then running it through the COVID perimeter framework is not as easy, because there are so many different activities performed by so many different people in so many different locations. So instead, we can look at it from a capability perspective and ask the question, what capabilities help us serve our customers or constituents? For example, an airline would assess capabilities such as those related to managing reservations, planes, flight staff, and so on. A hospital would assess capabilities such as those related to managing patients, medical staff, supplies, facilities, medicines, and so on. These are all essential capabilities, but you also have the ones that are not so in times of crisis like the current COVID crisis. Examples include managing training programs or performing employee annual reviews. Ideally, organizations already have an agreed upon capability inventory before the unexpected happens. But if not, start now so you can use it later again and again in the future. There you have it, the COVID perimeter framework. It helps you make decisions for yourself and the people you might impact. The virtual perimeter in this decision-making framework helps to keep the virus out. Just to make it a little more clearer, let's walk through a few use cases. You are the manager of a plant that makes face masks. You need to increase production to satisfy the current need. This is an essential but physical activity for your team. So you have to make sure that those employees who are likely to be contaminated do not come to work. Make sure that the areas are well ventilated and employees stay 6 feet away from each other at all times. You are a hospital administrator. Eliminate all non-essential activities and divert the resources working on them to essential ones. Explore how the essential physical activities can be converted to essential digital activities. You are a parent of young children and you might have elders to support as well. Again, eliminate all non-essential activities that put you in physical danger. For essential needs, perhaps you can make fewer trips to the grocery store or buy items online. The COVID perimeter framework is a tool for people to make decisions easier and reduce the chances of infection from the coronavirus, both for themselves and others while wearing different hats. We used business architecture principles, but our intent was to provide a simple decision-making tool. We used a few of the steps such as understanding the problem, scoping it, framing it, formulating and designing a solution, and communicating it. Implementation and tracking comes later. This video was to illustrate one way of thinking while simplifying the complexity so many can understand the concepts and use the tool to potentially save lives. There's a lot more to business architecture, but the idea here was to share a snippet of how it can be a valuable tool in addressing even large global problems. Wendy Keane and Raj Ramesh created this video collaboratively, either of whom you can contact at these email addresses. Thanks for watching, and please share this video with others who might find the COVID perimeter framework valuable in these challenging times.